All right, so it is day 34 or 35 of Alan's keynote study streak, and yesterday we covered two remedies. One was tuberculinum, and more or less similar remedy is basilinum. Now, in the Allen's keynotes, some Allen keynotes, it's given that tuberculinum dash basilinum, and then a new section was created for the new remedies where uh, basilinum was mentioned separately, and we see that many authors have also used it very differently in their practice. There were many compounds of tuberculinum which we use basilinum also similarly. And what is interesting is that both these remedies are more or less suited to cases where things are stuck up and it's not progressing. So let's proceed with some similar remedies today, which will help you in your practice to understand when cases don't proceed further, what will you do and what medicine will you give. So the first remedy that we'll be discussing is syphilinum. So if you see, it's a very short remedy which is mentioned in Allen, although it is requiring a lot of details, and if we go in different books we'll see that there are enormous details mentioned, but whatever is available in Allen's keynotes we'll make do with it and try to understand. So the first thing is mentioned for mental generals, and loss of memory is the first thing mentioned. Cannot remember names of books, cannot remember names of persons, places, and arithmetic calculation difficult. So those who are kind of stuck up in their studies and they are not proceeding because maths is a very difficult subject and it's a very serious issue which the parents do complain. This remedy can be indicated. They are very forgetful and so badly forgetful that everything is every next minute they forget. So in those cases we can indicate or give syphilinum, although there are a lot of things behind the scenes apart from the ones that are mentioned over here in Allen's keynotes to be prescribed for syphilinum. But since here we have little quantities of text mentioned, we'll proceed with that. Okay, so next we have sensation as if going insane, and this is very interesting. We saw this also in tuberculinum, basilinum, that there was borderline insanity. So some people have this habit of becoming, restless, becoming panicky, and they also wish to, do many several things at a time, and then they develop a habit of going into that phase where they can't, come out of it, and they kind of go crazy by doing so many things. Remedies like tuberculinum, acilinum, syphilinum will be suited for those type of patients. Okay. Next we have terrible dread of night on account of mental or physical exhaustion on waking. It is intolerable. Death is preferable. So many patients will complain to you that my complaints begin in the morning and they end at night. Some other patients will complain to you that complaints begin in the evening and end in the night. Some patients will tell you that the pains or the complaints start from the evening and lead onto the next morning, which is very important. And if we try to elicit these things from patients, we will be in a better position to give syphilinum or remedies which are snake serpents, which have more aggravation at the night time. Then we have pains which happen to increase from darkness to the daylight. We already discussed that. Begin with twilight and end with daylight. Similar remedies also we have Merck Sol and Phytolacam. Pains increase and decrease gradually. So we saw this remedy tuberculinum, which is having sudden increase of pain and sudden decrease of pain. Belladonna, sudden increase of pain, sudden decrease of pain. Pulsatilla, gradual pains and sudden stoppage of pain. Similar presentation we see in sulfuric acid also. In syphilinum, what we see is gradual pains. So the pains, the episodes start gradually, go gradually, and finish gradually, or they will persist for a long time and then they will go. That is also the case with sternum metallicum. And also, like we saw in tuberculinum, like we see in kali iode, kali bichromicum, and other remedies, that there is changeability of the complaints. Here in syphilinum as well, we see there is shifting pains and they require frequent change of position. So patient may not be comfortable in one position and may require to keep on or adapt new positions so that he can feel better in whichever position, or he can try to achieve that position where he feels better. Then we have all symptoms worse at night. Again and again it is repeating. So if things are repeating more than once, twice, you will see that it is of prime importance, because it is mentioned as a key symptom multiple times, and proved and proved in many persons, or the provers reported with many such aggravations during that period. Similar presentation we also see in Merksol. Then we have extreme exhaustion of body. So emaciation, extreme emaciation of the body. So all those cases which have been debilitated by the disease, or their genetic disposition is such that they can't put on the weight because of genetic factors or the disease which had troubled them at one point of time and disturbed their nutrition, their ability to put on the weight, we should think of syphilinum. Other remedies we discussed yesterday, tuberculinum, bacillinum, can also be thought. Similar presentation we'll see in abrotanum and iodum as well. Fears the terrific suffering from exhaustion on awakening, like the remedy lachesis. Then you have craving for alcohol in any form, hereditary tendency to alcoholism, Asaram europeum, sorinum, tuberculinum, sulfur, sulfuric acid. Headache which is neuralgic in character, causing sleeplessness and delirium at night, commencing at 4 p.m. So this is the aggravation time of lycopodium, and worse from 10 to 11 and ceasing at daylight. If it ceases at 11 or 12 p.m., then it is lycopodium. But if it ceases as soon as the sun has started to come up, it is syphilinum. And these are the minor things which we can corroborate from the patient and make a note and find the remedy for them, because modalities are easily elicitable in every case. Eliciting sensation would be at times difficult, sometimes easy, but modalities are pretty easy than the sensations. Then you have falling of the hair. So along with headache, there is falling of hair or some aggravation at the night which the patient complains. You should think of syphilinum. Acute ophthalmia neonatorum, lids swollen, other during sleep, pain intense at night, aggravated from 2 to 5 a.m. and pus is profuse and better by cold bathing. There is ptosis. So if you read one clinical condition in Allen's keynotes, you have to understand the background of what is mentioned. For syphilinum, it is mentioned ptosis, which is paralysis of the eyelids. Now you go back and study what happens in ptosis. So it is paralysis of local organ, which one muscle is weakened somehow. If you have a patient who has similar pathology, not about the eye but any other part of the body, and the local part is paralyzed, one part of the body is paralyzed, or there is a paralysis or weakening of that one part, think of syphilinum. So you have to think why is it mentioned and what is behind the scenes of what is mentioned. Then you will be able to decipher what is the hidden gems of Allen's keynotes. So you have the single muscle which is mentioned in Allen's keynotes for syphilinum, which is paralysis of superior oblique, and they look as if they are very sleepy, but actually it is because of the drooping eyelids and the ptosis of eyelids which is causing them look very sleepy. We'll see similar local paralysis also in causticum in graphitis. You have cases where they see two images, diplopia, think of syphilinum, one image is seen below the other. Teeth, one of the very important sphere of action for nosodes particularly, and we saw that in lachesis, we saw that in basilinum, we see that in medorinum. uh, the main sphere of action you will see is on the teeth. That is where the teeth are one of the most strongest organs in our body, and if a remedy is acting to cause a destruction of that part, then you can imagine the level of destruction the remedy can cause in the entire body. Once you understand that, you will see that these remedies are pretty deeper than what we imagine. And that is what happens over here. We see that the teeth decay at the edge of gum and break off. Literally they break off. They are cup, they look like cup shape. Their edges are serrated, they are dwarfed in size and converge at the tips. Also we see similar presentation in Staphysagria. Then you have heart complaints. There are severe shooting, lancinating pains from the base of the heart to the apex, from the base to the apex, and at night, especially, the aggravation happens, which is very, a commonality for syphilinum cases to get aggravated at night. If it happens from the base to the apex, then from the apex to the base, then it is medorinum. From the base to the clavicle, then it is shoulder, it is pygelium. Next, we have obstinate constipation. For years, rectum seems tied up with strictures. When enema was used, the agony of passage was like labor. So, you know, this was also a case, I think, somewhere in different literatures, you will read that the stools are not clear or they require a lot of effort, and it's been a problem since many years. Once syphilinum, one dose or the highest potency is given, it will ease off the trouble. Similar presentation we see also. The remedy mentioned is tuberculinum lichen. You will have patients with fissures in the anal region, but there should be aggravation at night or post dinner. Many times patients will not tell you that there is aggravation at night, they will tell you that it is happening after the night dinner. In those cases also you can pick up the night modality and give syphilinum. So there is fissures in the anus and the rectum, like the remedy Tuja, prolapse of the rectum, obstinate cases with syphilitic history. Then you have extremities, which is rheumatism of the shoulder joint or at insertion of deltoid. So you need to find out this point where the insertion of deltoid happens. And once you find that point, I have given to a few frozen shoulder cases where they had single pinpoint pain in that region only. Kali bichromicum did not help, ferrum metallicum did not help, and all the shoulder remedies which are normally indicated, they did not help. What was interesting is that pain was in one spot, and pain used to happen mostly in the evening and proceed throughout the whole night. Syphilinum 1M 1 dose cleared the case. So it is, also one of the interesting thing is that raising the arm laterally causes problems. And you have the comparative remedies mentioned, which is Rustox, and if it is the entire shoulder involved, then it is sanguinaria, and if it is left, then it is ferrum metallicum. Then you have leucorrhea, which is profuse, soaking through the napkins and running down the heels, like in the case of alumina. Eruptions are dull, red, copper colored, spots becoming blue when getting cold. So there will be obstinate cases of skin problems which have aggravation at night. Those patients which we are discussing in the last few sessions, who have tinea cruris or who have jock itch, which is normally called in layman language, they are not improving with the medicines that you have given. Maybe a dose of syphilinum or with the indicated medicine in between, this medicine is given and this will help push towards the positive direction, because most of these aggravations are also at night. So this can be an out of the box thinking, because if you are thinking in a normal way, it may not always work. You will have to also think something which is different, and something that is uh, you know something that will overcome the disease in a different thinking rather than in a normal thinking. So next, coming to the end of syphilinum, we see that when best indicated remedies fail, you have to think of syphilinum. And those who have had sexual history or sexual diseases, which is very rare now because of all the awareness and the protection they use, but there had been generations and generations who had been affected with it, and we see traits falling into the future generations. Syphilinum can be indicated based upon the modalities, which is at night, and you have similar symptoms of syphilinum with aurum, asafoetida, kali iode, murk or phytolacca in both diseases and syphilitic affections. So I would like to know, whatever audience who are attending on Instagram, on YouTube, have you ever used syphilinum in any cases? If yes, write in short what was the case, so that I can understand what what was your way of thinking for syphilinum. I had probably given to one of the cases where there was lot of pain in the shoulder in a single spot exactly at the point of insertion of deltoid, and that helped him. Few other cases of psoriasis which probably don't improve, vitiligo which don't improve. Syphilinum can be thought as one of the remedies indicated in between along with your constitutional remedy. It is not that you replace the constitutional with the syphilinum remedy, but you give few doses of syphilinum and then proceed with your treatment, which is what the patient requires. So anyone in the audience, there are few people on Instagram, on YouTube. Would you ever have you ever used syphilinum in cases? If yes, what was it? And then we'll proceed to the next remedy. So everyone is pretty silent, so they have not used it. So it's a good chance that you can go through Allen's keynotes again and try to find out what are the indications, and in some cases you will have to prescribe syphilinum just like you prescribe the other remedies based upon the indications. Next we come to is pyrogen. Now again, this is a remedy which will be indicated in cases where things are stuck up, especially in acute and subacute cases. And if you have patients who are going into septicemia, going into uh, you know uh, what do you say, increased viral load, or complaints which are not improving, especially the acute complaints, and the fevers especially are going out of control, think of pyrogen as one of the intercurrent remedies. So we'll discuss that. So you see, in pyrogen there is a very very strange feeling, and we have read it in many remedies, many materia medicas, which is bed feels hard, and the patient kind of keeps on changing position, like the remedy arnica. Parts lain on feel sore and bruised, like the remedy baptisia, and there is rapid decubitus, or painful ulcers that also happen because of the septicemia that has ensued. Other remedy being carbolic acid. So there is kind of a sore feeling, and then the next line shows you that there is great restlessness, must move constantly to ameliorate the soreness of the parts, like the remedies arnica, eupatorium, perfoliatum. So there will be cases where patients will just keep on being restless in their acute complaints. They will not have this feeling of soreness or bed feels too hard or something, but you will have more of this restlessness, which is indicative your objective signs which you will pick up from your observation or from the relatives that you will you know tell. In those cases you can think of pyrogen. So, Dr. Shailendra, you have used syphilinum CM single dose in once in paralysis. Very nice to hear. So, basically, these remedies, tuberculinum, bacillinum, which we discussed yesterday, and today, syphilinum and pyrogen, and some other nosodes, medorinum, which we have discussed, thyroidinum, which we will be discussing in future. These remedies are to be given in the highest potency. If you can get it in the highest potency, say 1 m, 10 m, 50 m, and keep it with you, they may be required. They are not the run of the mill medicines like arsenic and belladonna and aconite and etc. But you will require these at crucial periods when patients are not improving and you need to push them forward. In those cases, you can think of these medicines, nosodes, especially in the highest potency, sarcodes in the highest potency, they are going to push your cases forward. So let's continue with the pyrogen, what we are reading. There is a large and flabby tongue in pyrogen, which is clean and smooth as if varnished and fiery red. So once you read these words, which is large, flabby, clean, smooth as if varnished. Varnished means like how you see the paints which are very glossy, and fiery red. You have to understand few things once the words are mentioned, and I discussed that in the previous remedy also, syphilinum, where I told you that if ptosis is mentioned in single word, you have to understand the idea behind mentioning it. And once you understand that, you will be able to prescribe this remedy in multiple cases of similar pathologies. So there is paralysis of single part which we see in the background over there, and one of our viewers, Dr. Shailendra, has used it also. Many other doctors have used it. Maybe we don't have them on the live right now, but for pyrogen, once we see something that is mentioned that is fiery red and varnished, you have to understand that the entire circulation is involved. The remedy works on the circulation, and the entire circulation is involved to, you know, gather the entire, gather or bring all the energies in that part. That is what pyrogen is all about. It works on circulation, it works on blood specifically, and causes infective processes to go down. Then you have tongue, which is dry, cracked, and articulation is difficult, like the remedies Protalus horridus and terebinthina. So we read in terebinthine, the remedy which we discussed a few days ago with colchicum, that it has lot of bloody discharges, bloody stools, and lot of destruction that is happening. Similar state we'll see in Crotalus horridus also. These remedies will be required in extreme cases. Extreme means it's the disorganization of blood and decomposition of blood and uh, decaying of the tissues, etc., etc., or the beginning of decay. Next we have for pyrogen, vomiting. For the taste we missed that there is sweetish taste, terribly fetid, pus like as from an abscess. It's very few times you will get this from the patient, but if you do get, you can keep in mind. Vomiting which is persistent, brownish, coffee ground brownish, offensive, and stercoraceous with impacted or obstructed bowels, opium and plumbum. So now you see this commonality. Once you read these remedies, similar remedies in a street, you see the beautiful commonality, and the commonality, if you are able to pick up this commonality, you are going to straighten out many of your cases. What is the commonality? In tuberculinum, in bacillinum, in medorinum, in pyrogen, in syphilinum, you have something that is, getting affecting the bowels and especially the clearance of the stools. Once you understand that, you will understand how it is so important to keep the bowel mucosa intact, and these remedies are going to go over there and let the bowels clear out on its own, which is very essential for the health of the organism. So you have something in pyrogen like we saw in syphilinum, which is very much similar to what we saw in syphilinum, which is obstructed bowels. And in syphilinum also there was a case where obstructed bowels or stools which were not clear, and once syphilinum was given, it was as difficult as labor. This is the intensity of the remedy, and once you understand this intensity, the sphere of action, your job becomes easier in your clinic. You become flexible like as you want for the remedies, for the potencies, for the prescriptions. In pyrogen you also have diarrhea, which is horribly offensive. So now you see the second time that is mentioned offensiveness. Earlier it was fetid. So you have a commonality from this, which is to be understood that pyrogen is not a remedy which will give you something that is a very sweet looking appearance, but something that is going to be decaying or decomposing and offensiveness. And then you have also the remedy mentioned in bracket for diarrhea, which is horribly offensive, which is sorinum. Brown or black, leptandra is one of the top remedies in such cases also. Painless, involuntary, uncertain when passing flatus, like the remedies aloes and oleander. Then you again have constipation, rather it should have come before, but constipation with complete inertia, like the remedies opium and sanicula. Obstinate constipation from impaction in fever, stools, large black carrion like small black balls, like olives, opium and plumum are the other remedies. In CVS, cardiovascular system, so you saw this cardiovascular system had its mention in syphilinum, it has its mention in pyrogen. So you can understand how the remedy affects the circulation also. And once you see that there is some symptom mentioned, cases which land in your clinic which require help from the cardiovascular system point of view, you can think of giving pyrogen. Distinct consciousness of heart, if it feels tired, as if enlarged, purring, throbbing, pulsating, constant in the ears, preventing sleep, cardiac asthenia from septic conditions. So one of the things is very important when you practice homeopathy. There will be a class of homeopaths who will just think of one remedy at a time. There are different class of homeopaths, and if you see the stalwarts which we have in homeopathic you know in our field, they have given multiple remedies also. To stay stick to one remedy in cases of crisis may at times be difficult, because the economy of the patient is dying, and if you are not uh, getting back alive, getting it back alive where it needs to be, you will miss out on the patient. And the life is very important. So there will be cases where you will need to employ 2 3 medicines together. There will be cases where you will need to employ one remedy after the other, and then the previous again, and then the other, on everyday basis. In those cases you need to be on your feet all the time, so that you can kind of navigate the intricate pathology and help the patient. So you can see in cardiovascular system, for pyrogen it is mentioned cardiac asthenia from septic conditions. You'll have a patient who is landing into septicemia, the heart is now getting affected, you have given some remedy, he is in hospital, he needs that medicine which you have given. It can be constitutional, it can be any other medicine, but a dose of or two of pyrogen in between, like every 6 hours or every few hours, would probably settle down the economy and not let it worsen. You can continue your other indicated medicine as it is needed, and maybe you will have some better result after few hours, rather than someone who is deteriorating. One of the chief indications for pyrogen, and this you will see in clinics when the patients will land in your clinic, or you will see in ICU cases if you wish to undertake those cases, which is pulse that is abnormally rapid out of all proportion to temperature. another remedy is lilium tigrinum. Now you have to understand this. If the temperature is 100, 101, 102, the pulse will be 110, 120, 130, 140. In fact, in Boger synoptic key, one of the rubric which you see is mentioned that pulse and temperature discordant, which is not in sync, and the only remedy is pyrogen. So, so you have the remedy acting on the circulation right from the beginning, and that is what pyrogen is all about. Right in your clinics, when you examine the patient, the chest is clear, but you see that there is a very rapid pulse. The patient is complaining, or the relative is complaining that there was fever around 100, and there is kind of a body ache all over the body. Pyrogen 1 m every half hourly, every 1 hourly, you will see the result in 6 to 8 hours. This is the magic that homeopathy can do. Next we have is female reproductive system, fetus or secundines retained. So the meaning of this is that in cases of incomplete abortions, you will see that females keep on lingering with their pains or bleedings that keep on happening to them by improper dilatation and curettage. In those cases, pyrogen will help, sickle core will help. We saw other few remedies that also will be helpful. This fetus which is in incomplete abortion, part of incomplete abortion, has decomposed, dead for days, black, horribly offensive discharge, and never well since that septic fever following abortion or confinement. To arouse the vitality, active vitality of uterus, you can think of pyrogen. So those patients that land in your clinic with complaints or history of dilatation and curettage done once upon a time, you can think of giving pyrogen as one of the remedies. This will probably ease out the complaints or the grains of the complaint which are left out in the uterus, which prevent an an easy flow of normal menstrual cycle. And maybe pyrogen will set things all right and arouse the active vitality of the uterus, which is as mentioned. Lochia, which is thin, acrid, brown, very fetid. Nitric acid is the other remedy. Suppressed, followed by chills, fever, profuse, fetid perspiration. Then you have skin, which is pale, cold, of an ashy hue. Other remedy being sickle core. Obstinate and varicose, offensive ulcers of old persons. Other remedy being sorinum. Next we have is fever for pyrogen for septicemia cases, puerperal or surgical, from ptomaine or severe gas poisoning, during the course of diphtheria, typhoid or typhus, when the best selected remedy fails to improve or permanently improve the case. Chill begins in the back between scapula, severe general of bones and extremities, making onset of septic fever, temperature 103 to 106, and heat is sudden, skin is dry and burning, pulse is rapid and small and wiry, and you can see the number is mentioned 140 to 170. Cold clammy sweat follows. So what symptoms you see mentioned, we may not have the exact presentation in the clinic, which is why you need to understand how the fever cases are presented in your clinic. And there is a fever workshop which I am doing. The early bird prizes are mentioned on my timeline. You can go and have a look and register today or tomorrow. Tomorrow is the last date which we are ending with early bird, then the prices shoot up. So if you wish to register and learn about fevers, the different cases, how patients will tell you about their symptoms, how will you understand them from the repertory, how will you understand them from the materia medica, what will be the case taking pro forma that you will follow, whether it will be uh, location, sensation, modality, concomitant, or something else that needs to be defined. And for fevers it's even more intense and intricate, which you need to follow. And then what will be the key materia medica remedies that you need to keep in mind. It's not only about aconite, belladonna, arsenic, etc. There are a host of lot of remedies, each have their own indications. You learn them from material, you learn them from repertory. That is what I'll be teaching in this fever workshop, which begins on 15th of August. So those who wish to join, have a look at the details. They have been mentioned on the Instagram profile, also on the YouTube in the community tab, where we see the different posts that we can keep on mentioning. Go through them, and probably you will straighten out many cases of fevers in your clinic, rather than struggling with them and leading them nowhere, and probably only be the doctor for treating hair fall and skin diseases. So that's not only scope where we should always keep resting. We should be active, we should handle acutes and such grave pathologies which will show the world that homeopathy is a science and it needs to be fostered in this way. So that's all about pyrogen. And in septic fevers we read that it is very important. You can see the comparison for pyrogen, which is arsenic, carbovage, carbolic acid, opium, sorinum, rust ox, cor, veratrum. And after giving a simillimum, if the pyrogenic process or the pus is not going, it is troubling the patient again and again. The infective foci is there. It can be throat, it can be abdomen, it can be anywhere in the body. Sometimes it's pyro fever of unknown origin, pyrexia of unknown origin. Those cases also will be helped by pyrogen. This is just in short about pyrogen, but there are many things, especially in fevers. There are different ways of prescription. In acutes there are different ways of prescription. If you are staying along with this page, you are probably going to get some content which is practical, valuable and clinical for your practice. So that's all from me, and I hope to see you tomorrow again at 5 p.m. with another set of remedies from the Allen's keynotes. We have covered almost 100 odd remedies, and we are almost balanced with around 50 or 60 remedies. So we'll finish it off in maybe this month, and there is a good surprise for those who are attending on a regular basis, and they'll be getting this surprise very soon. So that's all from me right now, and let's meet tomorrow evening 5 p.m.